So today I want to show you a little bit of some myofascial release techniques I use with patients when they're having some neck and shoulder pain that's causing some of their headaches. So this is great for those people that are talking about having trigger points or knots that are always in like their upper trap or the levator scap that's right up here. And I'm going to use a big massage ball. You can use a smaller one like a lacrosse ball or a tennis ball as well. Tennis balls can also be really useful if you're really sensitive to touch early on with kind of doing these myofascial release techniques at home. Because it's a little bit softer and you can move to something a little more dense. So let's start with where do we want to put this ball? So we want to kind of put it right in where the muscle is, the top of the corner of the shoulder blade here. That's where the levator scap muscle goes. It goes from here, kind of up through the neck. The upper trap kind of goes from the top of the head and down out to the shoulder, so it's a little broader and more superficial of a muscle. But I think a lot of people get that levator scap is where that knot is. It's really painful and it can refer headache and neck pain sometimes. So we'll take the ball, we'll put it right there, and then I'm gonna lean back into this wall. And what we would do, I would start with just leaning into or find where that knot is first, and then get on top of it, and I'm gonna lean back into the wall and push, and I'm gonna hold this for about 30 to 60 seconds. While I'm doing that though, I'm gonna do some deep breathing to make sure I'm relaxing, I'm not guarding that shoulder, and I'm letting that pressure help the muscle kind of start to relax. After about 30 to 60 seconds, I'm gonna start then moving into some massage and like rolling back and forth on that knot to start loosening it up even more. So I'm gonna go back and forth and I'll go up and down as well. And for me, that knot kind of comes forward a little bit, like underneath the upper trap, you can feel it in the front. So I'm gonna turn and rotate a little bit and kind of angle into the wall and really get the length of that knot, that tight muscle there, and roll it out, up and down, back and forth. And again, I'll do this again for about 30 to 60 seconds as well. And rolling that out. And then next, I'll move into kind of more of an active mobility one. So I'll kind of find where that knot is again, reposition. And I'm gonna turn away from that side of the muscle. So my levator scap is on my right side here. I'm gonna turn and look about 45 degrees to my left. And I'm just gonna do some mobilization with it, looking up and down, because this puts that muscle on more stretch. And I would do about 10 to 20 repetitions or 30 seconds if I'm not good at counting while I'm doing things. Like exercising, I can't pay attention. I'll just set timers and go 30 to 60 seconds for everything. After I do myofascial release though, or if I have patients doing this at home, I'm gonna follow it up by supporting the muscle even more by doing strengthening exercises that really help it engage and improve the strength and endurance over time with that kind of exercise.